Caroline Leavitt held a press conference earlier today, and as you know, her, Trump, Vance, they're blaming all the Democrats for the shutdown, the government shutdown, which is obviously categorically false. And I broke it down yesterday. I'm not going to break it down again today. I told all of you why Republicans are lying and how they're lying, and Democrats don't want health care for every undocumented immigrant. That is a bald-faced lie. I explained it yesterday. I'm not going to go into the details again. However, I want you to listen to the way Caroline Leavitt answered this question, because she's asked what I think is a very important one, which is, if you happen to be an undocumented immigrant and you're suffering from, let's just say, a heart attack, or you're bleeding out, something that is very serious that you could lose your life, right? And you're dropped off at the ER. Should we help those people? Now, obviously, in my opinion, if you're any moral compass at all, you say yes immediately, right, Leonard? We would say yes, of course.
Any human being with any compassion at all would say yes.
Of course. Correct. I agree. Listen to the way Caroline Leavitt answered or didn't answer the question. Have a listen to this exchange.
Should ERs check for immigration status before treating a dying patient?
That's probably not a question for me to answer. I think that's a question for healthcare professionals and legal experts to answer.
I understand why I'm asking you, because Republicans have been saying that Democrats want to give benefits to undocumented immigrants, even though it's against the law for them to get these benefits.
Let me ask you, do you think that illegal aliens should receive Medicaid benefits? Medicaid benefits that go to the most vulnerable people in our country. Medicaid benefits that were designed to help low-income families and Americans in our country.
Notice how she doesn't answer the question. The question wasn't about...
She's conflating Medicaid with services.
The question wasn't about Medicaid being offered to undocumented immigrants across the country. That wasn't the question. The question was actually a very simple one that anybody with a moral compass would answer. And, you know, Caroline Leavitt, she walks around with that cross on her neck, but apparently we don't care about people if they're brown or if they're undocumented, even though they're human beings. The question was, if somebody goes into the ER that happens to be undocumented, that is dying, maybe a heart attack, maybe bleeding out, whatever the case may be, is it the Republican position that we should not help those people?
Like, oh, well, they're just going to have to die, I guess.
That was the question, right?
Right.
That's what I heard. And her answer or response was, well, you'll have to talk to the hospitals about that. First of all, I've never heard anybody at a hospital say, we're not going to treat you for life-threatening issues because you're undocumented. So that's number one. Number two, she says, well, we'll have to, legal people, we'll have to ask legal. It's not a legal issue. It's a human being issue.
Can I give a little background?
Yeah.
So in this state, for example, UMC is a state-run hospital. So they're mandated to take care of everyone, whether they're undocumented, whether they have ID, whether they have insurance. But you know who pays the bill? Once they do that, we do. We pay that bill through taxes. And the government, the federal government, doesn't get involved. But not every hospital has, if it's just a broken arm, for example, not every hospital has to take care of that person. But there are some mandated almost in every state. And so she's taken an issue, or I thought it was a terrible answer. Why doesn't she just answer the question and say, you know what, if the person's dying, yes, you have to take them in and save their life.
But Leonard, the reason why she won't answer the question is because we all know what the answer would be. If MAGA Republicans had it their way, they would not want an undocumented immigrant in this country to get life-saving health care if they're in the ER, because they are not pro-life, they are racist, they are bigots, and they only care about, I'm not even going to say they care about Americans. I think most of them care about Christian white Americans.
They're devoid of compassion.
Yeah.
I'll say it. If you have a dying person that walks into a medical facility anywhere in the world and you don't take care of that person, I would say that you're devoid of a conscience and devoid of any kind of
compassion. Am I wrong? Any decent human being in this country would say, yes, if somebody is losing their life and they need life-saving care in the ER, no matter what the color of their skin is, whether they're documented or undocumented, we should help that person. Most reasonable people with a heart would answer it that way. Now, if you want to talk about whether they deserve Medicaid,
well, that's what she did.
That's a different subject. Yeah. We're talking about life-saving care when somebody is dying and sent to the ER, and she wouldn't answer that question.
You conflated the two of them because Medicaid for undocumented is illegal. Sorry to interrupt you, but the listeners have to know it's illegal. It can't be done.
Right. And she calls herself a Christian, a person of faith. These people call themselves children of God, good, wholesome Christians. So I'm wondering what Jesus Christ would say if we have somebody in this country that doesn't have the proper paperwork, a decent human being, a hardworking individual that is having a heart attack, for example, and they're in the ER. And I'm wondering what Jesus Christ would say if Republicans told Jesus, we're not going to help you because you're not legal in this country. That is, again, I'm not a very religious person.
That's anti-Christian. I'll say it. Right. I'm a Christian.
I was just going to say that. I'm not a religious person, but I'm pretty sure that's anti-Christ. And that's who Caroline Leavitt is, and that's who these MAGA Republicans are. They are the Antichrist, meaning they are anti what Jesus Christ would tell you to do. They are not Christians. They are fake Christians. And another one is called J.D. Vance, our Vice President of the United States, who started talking about ERs and using the term illegal aliens. Have a listen to what J.D. Vance had to say about this.
About illegal alien benefits. Look, the text is very clear, and I even saw, I think it was George Stephanopoulos in an interview with Mike Johnson, did a fact check that was totally rooted in baseless claims. It was basically Democrat propaganda. If you look at the legislative text that they gave us, they tried to turn on two separate provisions that would give health care benefits to illegal aliens. Number one, if you're an American citizen, you've been to a hospital in the last few years, you probably noticed that wait times are especially large, and very often somebody who's there in the emergency room waiting is an illegal alien, very often a person who can't even speak English. Why do those people get health care benefits at hospitals paid for by American citizens? The answer is a decision made by the Biden administration that the Trump administration, working with congressional Republicans, undid. We turned off that money spigot to health care funding for illegal aliens. The Democrats, in their legislative text, want to turn it back on.
Okay, so first of all, Vance is saying that Trump and the GOP didn't cut emergency room access for immigrants illegal or not with their last budget bill, but what they will cut is the insurance coverage of 4 million Americans and double the insurance premiums of 24 million Americans. Also, that is a lie. Joe Biden didn't do what J.D. Vance is claiming that he did do. So again, the stance from J.D. Vance is basically, if somebody is dying in the ER, if they're undocumented, we shouldn't help them.
Well, wasn't he fear-mongering? Wasn't he saying, if we let these people get the care, then you're going to have to wait in a longer line because lines are long enough as it is. But can I clarify? Let me just clarify one thing. There is some limited medical coverage for people seeking asylum in America and refugees. When you end up coming into this country, there is a minimum amount of health care you can receive. Not illegals, not undocumented people, not people who have entered this country with bad intent, not criminals. And so what they're doing is they're taking a very, very tiny piece of what the law says, and they're trying to make that the standard. And and I don't even think it's clever because it sounds like a lie as it comes out of his mouth, at least to me.